If you or someone you love is over 60, you need to pay close attention to the warning signs of stroke. Stroke is one of the leading causes of disability and death worldwide, and older adults are at the highest risk. The scary part is that a stroke often comes without warning, but the hopeful part is that the body almost always gives signals before or during the event. If we learn to recognize these signals quickly, we can act in time, call emergency services, and possibly save a life. Doctors often remind us of the rule FAST: face drooping, arm weakness, speech difficulty, and time to act fast. But in reality, stroke can show even more signs, and the faster you notice them, the better the chance of recovery. Let us begin with the first two clear warning signs. The first warning sign of stroke is sudden facial drooping or numbness. This is one of the easiest ways to detect a stroke in progress. You may notice that one side of the face looks different from the other. For example, the mouth might sag, the eyelid might droop, or the person may complain of numbness or tingling on just one side. A simple way to check is to ask the person to smile. If the smile looks uneven or one side of the mouth does not move, this is a serious red flag. Many older adults try to ignore this sign, thinking it is just fatigue or a temporary weakness, but this can be a deadly mistake. When a blood vessel in the brain is blocked or bursts, the nerves controlling the muscles of the face cannot function normally. This causes the droop. Experts from the American Stroke Association emphasize that even if the drooping disappears after a few minutes, it could still mean a mini-stroke or transient ischemic attack, which is often a warning of a bigger stroke ahead. That is why no facial change should be taken lightly. Immediate medical attention is critical. The second warning sign of stroke is sudden weakness or numbness in the arms. This symptom often happens on just one side of the body, and it can appear very suddenly. The weakness may range from mild, such as difficulty lifting a cup of tea, to severe, such as not being able to raise the arm at all. One quick check is to ask the person to raise both arms in front of them and keep them there. If one arm drifts downward or feels weak, this could be a sign of stroke. Sometimes older adults may not complain of weakness, but may suddenly drop things from their hand or feel a strange heaviness. The reason this happens is the same as with facial drooping. When blood flow to part of the brain is cut off, the nerves that control muscles on one side of the body stop working properly. According to the Centers for Disease Control and Prevention, weakness or numbness in one arm is one of the most common and reliable early warning signs. Again, even if the weakness improves after a few minutes, it must not be ignored. A small stroke today can lead to a major stroke tomorrow. Calling emergency services is always the safest choice. The third warning sign of stroke is sudden speech problems. This can include slurred speech, difficulty finding the right words, or not being able to speak at all. Sometimes a senior may sound like they're drunk even if they have not touched alcohol. The words may come out garbled, or they may use the wrong words without realizing it. In other cases, the person may understand what you are saying, but cannot respond clearly. One of the easiest at-home checks is to ask them to repeat a simple sentence, such as, "The sky is blue." If they cannot say it correctly, or if their words sound strange, this could be a serious red flag. Doctors explain that when a stroke affects the areas of the brain responsible for language, such as Broca's or Wernicke's areas, speech problems appear immediately. These problems may last for just a few minutes in the case of a transient ischemic attack, or they may persist during a full stroke. Family members often make the mistake of waiting, thinking the problem will go away on its own. But every second counts. Speech problems are one of the most reliable and visible signs of stroke, and ignoring them can delay life-saving treatment. The fourth warning sign of stroke is sudden vision changes. This can mean blurry vision, double vision, or complete loss of sight in one or both eyes. Some older adults may complain that their vision has suddenly become dark, as if a curtain has fallen over one eye. Others may see double, which makes it difficult to walk, read, or recognize objects. In some cases, vision loss is painless, which makes it easy to dismiss as a minor problem, but in reality, it is a medical emergency. When blood flow to the parts of the brain that control vision is interrupted, the ability to process visual information is damaged. According to neurologists, vision problems during a stroke are often overlooked because people think it is just an eye issue. But the truth is, sudden vision changes, especially when combined with other symptoms like facial drooping or arm weakness, strongly suggest a stroke. It is also important to note that strokes in the back part of the brain, called the occipital lobe, often present first with vision problems. That is why organizations like the American Stroke Association have expanded the FAST rule to be FAST, where the E stands for eyes. If a senior suddenly cannot see properly, even if it improves after a short while, do not delay. Immediate medical care is necessary to prevent permanent vision loss or severe brain damage.
The fifth warning sign of stroke is sudden trouble with balance, walking, or coordination. This often appears very abruptly. A person may be walking normally one moment and suddenly find themselves staggering, swaying, or unable to stay upright. Some seniors describe it as feeling dizzy or as if the ground is moving beneath them. Others may suddenly lose control of their hand movements, making it difficult to hold objects, write, or even bring food to their mouth. This loss of coordination happens because a stroke can affect the cerebellum, the part of the brain that controls movement and balance. Doctors emphasize that this is not the same as the mild dizziness that comes from standing up too quickly. Instead, it is intense, unexpected, and often combined with nausea or vomiting. One way to check is to ask the person to touch their finger to their nose or try walking in a straight line. If they cannot do these simple tasks, or if their movements appear jerky and uncontrolled, it could be a stroke. Many families mistake this for fatigue, vertigo, or even clumsiness. But if an older adult suddenly loses their balance or coordination, it must be treated as an emergency. Every minute that passes can lead to greater brain damage. The sixth warning sign of stroke is sudden, severe headache, especially when it comes without any clear reason. Most strokes, particularly ischemic strokes, do not always cause pain. However, in hemorrhagic strokes where a blood vessel bursts and bleeding occurs in the brain, a headache can be the first and most dramatic symptom. Seniors often describe it as the worst headache of my life. It comes on instantly, not gradually like a migraine, and may be accompanied by nausea, vomiting, or changes in consciousness. Some people also become unusually sensitive to light or noise at the same time. According to neurologists, this type of headache should never be ignored, especially in an older adult who does not normally suffer from severe headaches. Family members sometimes think it is just a normal headache or sinus problem, but the sudden intensity and unusual nature are what make it different. A powerful headache that strikes out of nowhere and does not ease with rest or common medicine is a strong warning sign of stroke. Medical experts stress that this is particularly dangerous because hemorrhagic strokes progress very quickly and can be fatal if left untreated. That is why immediate emergency care is essential the moment this kind of headache appears. The seventh warning sign of stroke is sudden confusion or difficulty understanding speech. This is different from normal forgetfulness that many seniors may experience. In a stroke, the change is rapid and obvious. A person may suddenly seem lost, unable to follow a simple conversation, or unable to understand common words that were familiar just moments ago. For example, you might ask them to pick up a glass of water, and they look at you as if they do not know what you mean. Some may respond with words that make no sense, or they may stop speaking altogether because they cannot process what is being said. Doctors explain that when a stroke affects the brain regions responsible for comprehension, the ability to understand language breaks down almost instantly. This can be very frightening for both the senior and their family because it often seems as if the person's personality has changed in a matter of seconds. Family members sometimes mistake it for dementia, Alzheimer's disease, or a simple age-related confusion. But the key difference is the sudden onset. If confusion or difficulty understanding appears suddenly, it is most likely a stroke and requires immediate emergency care. The 8th warning sign of stroke is sudden numbness or weakness in the legs. While most people think of stroke as affecting the face or the arms, it can also target the lower body. A senior may suddenly be unable to walk, may feel one leg become weak or heavy, or may drag one foot when trying to move. In some cases, they may suddenly collapse because the leg cannot support their weight. This symptom occurs because the brain areas that control leg movement and sensation are being damaged by lack of blood flow. According to medical experts, leg weakness in stroke usually appears on one side of the body, the same side that might also show arm weakness or facial drooping. Families sometimes confuse this with arthritis, fatigue, or a simple muscle cramp. But the difference is in how suddenly it happens. If an older adult is walking normally and then within seconds cannot move one leg properly, this is a dangerous sign. Ignoring it can lead to falls, severe injury, and most importantly, missed treatment for stroke. Doctors emphasize that combining leg weakness with any other warning sign, like speech problems or vision changes, makes the diagnosis even more urgent. Calling emergency services immediately is always the safest and smartest choice.
The 9th warning sign of stroke is sudden dizziness or loss of coordination accompanied by nausea or vomiting. While we already discussed balance issues earlier, dizziness combined with sickness is a very specific warning sign. A person may suddenly feel the room spinning around them, lose their sense of direction, or be unable to sit or stand without help. What makes this more alarming is when it happens instantly, with no history of vertigo or ear problems. Seniors may clutch their head, close their eyes tightly, or even collapse because the dizziness is so overwhelming. Vomiting often comes with this type of stroke because the brainstem, which controls many of the body's automatic functions, is being affected. Doctors warn that when a stroke hits the brainstem or cerebellum, dizziness and vomiting can be the very first symptoms. Sadly, this is also one of the most overlooked warning signs, as families may assume it is just a stomach issue or food poisoning. The key difference is that this dizziness is sudden, powerful, and paired with neurological symptoms. If a senior suddenly becomes dizzy, disoriented, and begins vomiting without warning, it must be treated as a stroke until proven otherwise. Emergency medical attention is critical because strokes in this area of the brain can progress quickly and lead to life-threatening complications. The 10th warning sign of stroke is sudden trouble swallowing. This symptom is known medically as dysphagia, and it can appear during a stroke when the muscles that control swallowing are affected. Seniors may suddenly cough or choke when trying to drink water or eat food. They may also complain that food feels stuck in their throat, or they may drool because they cannot properly control their mouth muscles. In more serious cases, they may not be able to swallow at all. Doctors explain that this happens when a stroke damages the nerves and muscles in the brainstem that are responsible for swallowing. This is extremely dangerous because it increases the risk of choking or inhaling food into the lungs, which can lead to pneumonia. Families sometimes dismiss swallowing problems as a minor issue, but during a stroke, it is a life-threatening warning sign. Immediate medical attention is critical because strokes in this area of the brain can progress quickly and lead to life-threatening complications. If a senior suddenly cannot swallow properly, it is not safe to wait or hope it will improve. Calling emergency services right away can save their life and reduce the risk of long-term disability. We have now gone through the 10 major warning signs of stroke in seniors over 60. To quickly remind you, these include sudden facial drooping, arm weakness, speech problems, vision changes, loss of balance, severe headache, sudden confusion, weakness in the legs, dizziness with nausea or vomiting, and trouble swallowing.
Each of these signs can appear very suddenly, and even if they last for just a few minutes and then disappear, they must be taken seriously. Doctors call these temporary episodes mini-strokes or transient ischemic attacks, and they are often a warning that a much larger stroke may happen soon if no action is taken. The most important lesson is this: time is everything. The faster you recognize the signs and call emergency services, the better the chance of recovery. In fact, brain experts often say, time lost is brain lost. Every minute during a stroke, millions of brain cells can die. Treatments like clot-busting drugs or advanced procedures to remove blockages work best when started within the first few hours. This is why no one should ever wait to see if the symptoms will go away. Never try to drive yourself or your loved one to the hospital. Always call the local emergency number so trained professionals can begin treatment as quickly as possible. For seniors, it is also important to focus on prevention. Managing blood pressure, controlling diabetes, avoiding smoking, staying active, and eating a heart-healthy diet can greatly reduce the risk of stroke. Regular checkups with a doctor and taking prescribed medications as directed are also key steps in prevention. Families should educate themselves and practice the fast or be fast rule together, so that if a stroke ever happens, they know exactly what to do. Remember, stroke is not only a disease of the elderly, it can happen to anyone. But the risk is highest in those over 60, which is why awareness is so critical. By learning to recognize these 10 warning signs and acting immediately, you can protect yourself and your loved ones from one of the most dangerous medical emergencies. So take this knowledge seriously, share it with your family and friends, and always remember, recognizing the signs of stroke quickly can be the difference between life, disability, and death. Stay alert, stay informed, and stay healthy.